And I should mention right at the outset a special thank you, Dr. Ramachandra Rao, for that very inspirational and moving story, which reminds us about what this is really all about. I'm privileged to be invited here to speak at this event by the owners of such a prestigious institution as Global Hospital. This institution has a proud record and a justified reputation as a centre of excellence. I'm sure you'll hear much more, and you've heard more already from others about Global's many achievements. Let me mention a few that really caught my eye. Global Hospitals conducted the first heart transplant in the undivided state of Andhra Pradesh. I believe they're the only Indian hospital to be associated with King's College Hospital in London for work on liver transplants. And they completed 15,000 radial procedures by May 2010, which is the highest volume in the country. And I was particularly struck hearing Dr. Sudhakar speak about the stem cell research work, which is truly cutting edge and very, very exciting, offering a future to patients who perhaps would have had a very bleak outlook in the past. This is one of the areas that the UK and India is working together on a great deal on research in these areas, so I'm very excited to hear about that. Now, these are impressive statistics in their own right, but it's what lies behind them that's really important. They've transformed the lives of so many patients, and that's what drives and motivates the dedicated team of managers and medical professionals that provide these services. And I'm particularly proud to know that many of them have trained and qualified in the UK, which is probably one of the reasons why I've been asked to speak here today. Because Britain and India share many things. We have ties in trade, in culture, in science, in global economics, in politics. But sadly, we also share experience of some of the challenges posed to human health by modern living, with the rise of illnesses like diabetes, cancer, heart disease, and all the related conditions. I myself received a scare today when I was told that a very close relative in the UK had been admitted to hospital with a suspected heart attack. Fortunately, that wasn't, as it turned out, the case, but I know only too well how the impact that heart trouble has. It's a very prevalent problem where I come from. I have lost members of my own family through it. But that shared experience means that we have much to offer each other in terms of tackling these modern day challenges. So let me offer a few facts from a British perspective. Coronary heart disease is the UK's single biggest killer, but we're leading a fight against it. We're doing this with a world-class public health system which works on evidence-based medicine. We all know that prevention is better than cure, but when the chips are down, we all need to know that we can rely upon the services of world-class hospitals like Global to intervene in the worst-case scenario. And we have that confidence in the UK too, because the UK is a pioneer in transplant surgery. Britain's first heart transplant was successfully carried out in 1968 by a team of 18 doctors and nurses at the National Heart Hospital in Marylebone, London. The first joint heart and lung transplants were performed at Harefield and Papworth hospitals in 1984, and the first isolated lung transplant at Freeman Hospital in 1987. But that's only part of the infrastructure that supports an entire system of care for transplant patients. The UK Specialist Ambulance Service, UK SAS, not to be confused with the military wing of that same acronym, are the experts in the provision of specialist ambulance support. They are currently operating ambulance services for emergency care for the Maharashtra state government. And UK SAS understands the specialist needs of transplant teams and their patients. They can coordinate road and air transportation to ensure the safe and timely delivery of human organs, tissues, blood, and medical teams to destinations throughout the United Kingdom and the rest of Europe. And it's in areas like this, sharing expertise and providing an end-to-end service to meet the needs of patients that the UK has much to offer. That's why we're looking to work together with prestige institutions like Global to bring the best of what we can offer and combine it with the best that India can offer. We're doing this through Healthcare UK, a joint venture between the British Government's Department of Health and UK Trade and Investment, which is a focal point for healthcare partnerships between UK organisations and healthcare providers around the world. As such, it has in-depth knowledge of the expertise available in the UK in both the commercial sector and the NHS, the National Health Service. And it's designed to lay the foundations for these partnerships. I'm very much looking forward to seeing this take fruit here, in Hyderabad, in Telangana, in Andhra Pradesh, and more widely. We are at our best when we work together, in collaboration, sharing resources, sharing expertise, and, of course, sharing in the successful outcomes from this collaboration. And that's why I'm here today, to be a part of that. Thank you very much for listening.